Hello, this is Alice Shapiro. This is a narration for the PowerPoint for HO 150, Human Body Systems 1. And as you can see, this is Chapter 13, Blood Vessels. So this will be an overview of the structure and function of blood vessels to complete our unit on the cardiovascular system. First of all, the functions of blood vessels are to carry blood, to exchange nutrients, waste products, and gases within the tissues, to transport substances, and to regulate blood pressure. And we'll see how all that is done. There are several types of vessels. Arteries, and I see arteries was misspelled. Excuse me, I didn't notice that before. Arteries carry blood away from the heart. By definition, arteries carry blood away from the heart. They are thicker walled than other vessels in the cardiovascular system, and they have a great deal of elasticity, elastic fibers. Veins, by definition, carry blood towards the heart, and they have less elastic. They are thin, and again, there's another misspelling. Boy, oh boy, it should be thin with less elastic. Capillaries, this is where the exchange occurs between the blood and tissue fluid. So we could say that the capillaries, and listen up, capillaries are the functional units of the cardiovascular system, because here's where the exchange occurs. Blood flow. Blood flows from arteries to arterioles, then to capillaries, then the exchange takes place in the tissues, then into venules, and then into small veins, and then the larger veins return to the heart. Please understand this distinction. And this goes along with the requirement to learn the blood flow through the heart as it first returns to the right atrium. There are several types of arteries. Elastic arteries are the largest in diameter with the thickest walls. The aorta and pulmonary trunk are these types of arteries. Muscular arteries are medium to small size. They are thick in diameter and contain smooth muscle cells, and they can control to some degree the blood flow to different body regions. Capillaries, blood flows from arterioles into the capillaries, and the capillaries branch to form networks. The blood flow into capillaries is regulated by smooth muscle cells of the pre-capillary sphincters. And here is a diagram of a capillary network showing you at the top of the page an arteriole, and then the precapillary sphincter, which can regulate when and how much blood will flow into the capillary network itself. Then notice from the capillaries, and where you kind of see the color going from red to blue indicates that at the proximal portion, proximal to the arterioles, is where the exchange, let's say oxygen and nutrients, are diffusing out of the capillaries into the tissues and then into individual cells. And then at the venial end, closer to the venule, the capillaries have picked up carbon dioxide and other waste products that will be transported back ultimately to the heart. Here is what a capillary looks like. It's a thin layer of simple squamous epithelial tissue, and this thinness facilitates the exchange of gases, nutrients, and waste products between the blood and the tissues. And by comparison, on the right-hand side, on your right, shows a red blood cell. Now, veins. As you saw, blood flows from capillaries into venules. There are all three tunics present in small veins. Medium-sized veins collect blood from small veins to deliver to larger veins, and the large veins contain valves to prevent the backflow of blood. And I see another typo in one of the veins, the spelling of one of the veins. I need a proofreader, I guess. I'm usually a pretty good proofreader, but now you can see I'm human, which you knew already. All right, veins continue. The superior vena cava is a very large vein that returns blood from the head, neck, thorax, and right upper limbs and empties directly into the right atrium. The inferior vena cava also empties into the right atrium and returns blood from the abdomen, pelvis, and lower limbs. Blood pressure is the measure of force the blood exerts against the blood vessel walls. Systolic pressure is the higher pressure, and it indicates contraction of the heart. Diastolic pressure is the lower pressure and indicates the relaxation of the heart. Normal is considered to be about 110 to 120 systolic and about 70 to 80 diastolic. Above those would be considered high blood pressure. Here is a diagram of how to measure blood pressure. Please review this. I think the take-home message is that when the brachial artery, which is the normal artery for taking blood pressure measurements, when the cuff pressure decreases and is no longer to keep the brachial artery closed, the blood is pushed through the partially open artery, and then we hear a small sound, a turbulent sound, and that indicates the systolic or higher pressure. When the cuff and the vessel are totally open, we cease to hear sounds because the blood is just flowing through the largest diameter, and that would be a measurement of the diastolic pressure. Capillary exchange. Most exchange occurs across the walls of the capillary by diffusion. Blood pressure and the permeability of the capillaries and osmosis affect the movement of the fluids across these capillary walls. So we'll see in a moment there is a pressure gradient that allows diffusion just by osmosis into the tissue at the arterial end and into the capillaries at the more towards the venial end. Net movement of fluid is from blood into the tissues. There will be a small amount of fluid that remains, and this is removed by the lymphatic system. And here is another diagram that you need to take closer looks at that shows you capillary exchange. Here's the arterial end where the arteriole meets the capillary network, and there's higher pressure, higher than in the tissues themselves. Net movement of fluid is out of the capillaries. There's some movement into the capillary, but net movement is out because the pressure is higher here. Once material is lost from the capillary, then the net pressure becomes lower compared to the tissues, and more volume then moves in from the tissue spaces towards the venial end of the capillary network. Okay, so take a look at this. Notice that about 1/10 of the volume passes into lymphatic capillaries and will then be returned to the venous system. There is local control of blood flow, which is achieved by relaxation and contraction of the precapillary sphincters. When the sphincters relax, blood flow into the capillary network increases. The precapillary sphincters are controlled due to the metabolic needs of the tissue, and also to some degree by the concentration of nutrients in the tissue. Blood flow increases when oxygen level in the tissues decrease. Think about that. If that doesn't make sense to you, think about it some more. And if you still have questions about that, please get in touch with me. Here is an example of the precapillary sphincters. They relax when the tissue concentration of nutrients such as oxygen, glucose, amino acids, and fatty acids decrease. Because the blood is carrying those nutrients, if the nutrients are low in the surrounding tissues, the precapillary sphincters will relax and allow blood to flow into the capillary network to be then admitted to the tissues. Okay? Sphincters relax as the concentration of metabolic byproducts such as CO2 and lactic acid increase, and as the pH decreases or as acidity rises. The precapillary sphincters will contract when the tissue concentration of nutrients increases. All right, so take a look at that again. Think about that some more, and this is a very important concept. There is nervous and hormonal control also of blood flow. Vasomotor center is part of the sympathetic division of the autonomic nervous system, and it controls blood vessel diameter. It also, as we reviewed in the chapter on the heart, it also has effect upon the heart and heart rate and stroke volume and cardiac output. Vasomotor tone, there is a state of partial constriction of blood vessels. When vasomotor tone increases, it causes blood vessels to constrict and blood pressure to go up. Epinephrine and norepinephrine are chemical regulators, and they are produced by the adrenal medulla, and they also alter blood vessel diameter. This shows you the diagram of the nervous system regulation of blood vessels. Notice the vasomotor center in the medulla oblongata sending out stimulus via sympathetic nerve fibers to blood vessels. And it has to do with the frequency of action potentials that innervate these blood vessels. In most blood vessels, as it says here, increased action potentials will cause vasoconstriction, and decreased action potential frequency will cause vasodilation. There are also baroreceptors. Baro means pressure. There are pressure receptors that respond to stretch in the arteries. They're located in the carotid sinuses of the carotid arteries and in the aortic arch. They change peripheral resistance, heart rate, stroke volume in response to blood pressure. So as blood pressure goes down, heart rate and stroke volume and cardiac output will go up. As blood pressure goes up, heart rate, stroke volume, therefore cardiac output will go up. Blood pressure up, cardiac output down. Blood pressure down, cardiac output up. All right, so here are the baroreceptors, and this shows you what occurs. Here is some sensory input from the carotid sinus baroreceptors in the carotid artery and from the aortic arch baroreceptors. And these are stimulated by the parasympathetic branch of the autonomic nervous system to the heart itself, as well as sympathetic nerves. So notice the heart has parasympathetic, which will generally slow heart rate and cardiac output, sympathetic, which will generally raise heart rate and cardiac output. Negative feedback. You had a very similar diagram to this, including the heart in the last section when we looked at the heart itself. So this is kind of a review and reviews the concepts that we just talked about. Please take a look at this diagram either in your textbook or in the PowerPoints. All right, a little bit more information before we end this show, let's say, before we end this PowerPoint narration. Arteriosclerosis is a general term for what we might say is hardening of the arteries. All of these conditions make the arteries less elastic. The really most predominant type of arteriosclerosis is atherosclerosis. Notice this is a type of arteriosclerosis, and in this instance, deposits of materials occur in the artery walls. We call these deposits plaque. Factors that contribute to atherosclerosis are lack of exercise, smoking, obesity, diets that are high in cholesterol and trans fats, and some genetic involvement. But for most people, a diet, poor diet, lack of exercise, and smoking are huge risk factors for cardiac disease. And this is what atherosclerotic plaque may look like. Notice it narrows the effective diameter of blood vessels, among other things, but this can impair the flow of blood to tissues, and this can occur also, as we looked at before, in the coronary arteries, which is of course extremely serious and can lead to a myocardial infarction. All right, this is the conclusion of the PowerPoint narration for chapter 13 and also the last one in the cardiovascular section. Please contact me if you have questions, and have successful studying.